Yeah. So yes, Bhavya, tell me when the live starts. I'll begin with the introduction.
Okay, Arman, we are live.
Yeah. So good evening to everyone who has joined us in this webinar. In view of this ongoing COVID pandemic, where India is being so severely affected, this session was the need of the hour. Owing to being so much on social media these days, be it for getting oxygen cylinders for our loved ones or for helping each other out, we know how much fake news is spreading all around. In such times, not only is it a need, but a necessity that we take our advice from the professionals of this field who know much better than a random WhatsApp message or a random Instagram story. Hence, we take great pride in inviting these experts to address your concerns and queries related to COVID. We have with us Dr. Atul, who is an ENT specialist, Dr. Meenakshi, who is a gynecologist, Dr. Mrinalini, who is a dentist, and Dr. Arman, who is pursuing MBBS. Our honorable guests are not only helping the people in the field, but also virtually as well. With their page Doctors in the House, they regularly hold question and answer sessions for all of their followers. Even I personally have been using the tips in their highlights to help people out and even my own family members. So, on behalf of all of us, thank you so much, ma'ams and sirs, for doing this for all of us. We are really grateful to you and your page for helping, for the help that it is providing us all. And before beginning with the questions, I would like to ask all of you, how are you all coping up with all this stress? With the layman having anxiety and panic nowadays, how do you all keep yourself motivated even while answering so many questions related to this ugly disease?
Well, as of right now, we ourselves we contracted COVID despite the vaccines. So we were all isolating separately, and we had our own daily schedules. Actually, even the page was a good outlet for us because it used to engage us. So I think it's very important to have a schedule A, and secondly to have something that keeps you involved mentally. Otherwise, anxiety is something that's very, very common during this phase. Mental health has been affected a lot.
Also, I think, as doctors, even when we were unwell, you need to be there for your patients because they were unwell too. So we had been on video calls and video consultations throughout the while when we were unwell. And actually, I think as doctors and you're doing your bit, it kind of is ingrained in you, makes you definitely feel better, helps you recover faster. So yeah, it was a tough time, but then it was a good time, and we are all back normal and healthy. So that's a good thing.
That's wonderful to hear. And ma'am, you were telling us something that you had gotten the vaccines as well, and still you were affected by the disease. So, like, is there anything you would like to say about that?
Well, we all had our vaccine shots, and I think the second shot was sometime end of February. So, which pretty much made it about 2 months from our last shot when we got the disease. But all thanks to the shot, our disease has been very, very mild. Has been very mild, and we the fever lasting for very short periods, and it came around faster. And so I would recommend that everyone who has the chance should take the shot. I mean, you may argue that we still got it, but then at least we got mild.
So that's a very straight message to all the skeptics out there that please do get the vaccination. At best, it will prevent you from getting the disease. And at worst, even if you do get the disease, it will definitely be milder than the course it was planning to have in your body. So do get your vaccination shots as soon as you can.
And ma'am, when people are getting their vaccine, so ma'am, they have two choices. Either it is Covaxin or Covishield. So, and that is also a very recurring question. So people are asking which vaccine is better, and if any vaccine is better, if that is also a thing.
Yeah, I must confess that it's a very interesting question, and we've been getting it all this while ever since the vaccine got open to everyone. I must honestly tell you that when the vaccine was open only for healthcare workers, which, I mean, probably we were like the guinea pigs when the vaccination was being given, none of us were actually bothered about whether it was a Covaxin or Covishield. So at the end of the day, weighing both of them, they're almost the same. So please don't kind of keep on bothering yourself with this question that whether it should be a Covishield or a Covaxin. Whatever vaccine is available to you, is accessible to you, please go ahead and get it done as soon as possible.
Well, I hope that answers most of our questions because, in my locality also, and since my mother is also a doctor, most of the calls that she's getting, it is like, so should we get the vaccine? Which vaccine should we get? So, ma'am, thank you so much for clarifying this from the beginning itself. And ma'am, beginning with the questions, one of the questions is, what are some of the symptoms of the second wave of COVID-19? Because in the second wave, since the strain has also gotten stronger, the symptoms have also become even, they are more different than the last time.
See,
So
this particular strain, it's more infective, so it spreads faster. So previously, you were getting one or two people in a whole family who were getting it. Now, whole families are getting it. So it spreads faster. Other thing which has been seen that more people are having upset tummy. So an upset stomach was not so common previously as compared to now. The chest involvement on CT is slightly more compared to the previous one. But all in all, it's not more fatal or this thing than the previous one. So it's pretty much similar. So it spreads faster. It's getting more, in particular, whole families are getting affected. That's why instead of one, we're getting 4 people together. That's why this wave was so much stronger. But this is not more fatal in any.
and so, is there any difference of the symptoms depending upon the age group? Like one of the questions is, what are the symptoms of COVID in children? So for children and in women, especially pregnant women, are the symptoms any different, or does this affect them even more so than the normal people?
So we all know that it's a virus which is mutating over and over again. So I would actually tell you that you have a routine in your life. There's a particular exercise that you do every day or go to work or something. So whatever is your routine, if actually in today's date and time, if you are feeling different compared to what you feel every day, the first thing you must keep in mind is COVID. It's really important to understand that I started my symptoms with a very severe backache. I isolated immediately, took a tablet of Dolo to get my backache down, but the first thing I did was isolate and give my RT-PCR. And after that, in 2 hours later, I had a high fever. So what I'm trying to say, whether it's a loose motion, it's an upset stomach, it's a cough, it's a cold, it's a fever, it's a severe body ache, or it's a loss of taste or smell, the first thing that you must keep in mind is COVID and isolate. Wait for your reports and tests and whatever, but at least stop the spread of the disease as soon as you can.
And as for the children, so in children, the symptoms are quite similar as well. You get fever, cough, a lot of red eye, and even drying up of lips has been seen in children.
So this is a new feature in the newer strain, or was it there earlier as well?
We're actually just learning about the disease on the go. So right now, this is what has come up in the newer guidelines.
Also, probably in the first wave, children were not as much affected, nor were the youngsters. So now in the second wave, we are seeing definitely more youngsters affected and few children affected. And it is said that once the youngsters are also vaccinated, the third wave, because the children will probably be the one who are most at risk. So that might affect the children even more.
And so the next question is, is it possible to be infected even if you are at home during the second wave? Because most of the cases, since even the old people in the families, they are getting infected. They're not even going outside, but still they are the first people in the family to get infected. So, is there any specific reason behind that?
So basically, the main reason is that this disease itself is very infective. And overall, you would see that the geriatric people are most at risk to develop symptoms. So most of the times what happens is there is a lapse in judgment here or there with one COVID case, and therefore the disease enters the entire household. Inside the household, maintaining social distancing and everything is very hard. Being isolated completely also has its risks because there are always breaches. And so you need to control those breaches of safety, like going to the grocery store or coming back from the grocery store, trying to take a shower after that. So even if you're isolating and quarantining properly, you're maintaining social distancing, if you're staying inside your house with all lockdown norms, you can still get the virus.
And also all the interaction with delivery people should happen in an open space. Lots of apartments, have a closed space in front of the house, next to the lift, where there is a closed stairwell, where a person who's come to deliver will keep standing for about 5-10 minutes while you fetch the money and you get it. That person may not be following the guidelines, and the virus does tend to aerosolize. So it may actually be hanging inside there. And while that chap leaves and you just step out, pick up your stuff, you may still be able to catch it. So all interactions have to be in the open, and that chap may leave this thing at your gate and go away, and then you can pick it up from there, rather than inviting anybody right onto your doorstep. Don't try and do that.
You must remember that everyone can be, and you have to, at this point of time, treat everyone as at least an asymptomatic carrier, if not a COVID patient. Everyone you interact with. So please wear your mask at all times.
Wow, how the times have changed. And I'm talking about the increased rate of infection. And ma'am, since you are all medical professionals, so ma'am, are there any special things that you do to keep yourself safe? Because you are obviously getting even more exposure being doctors yourself. So at home, is there anything special you do?
At home, or actually the point is that the infection will come with whoever's going out of the house. So I think you have to take that care outside the house. So it's we've been talking about the masking. Everyone's been talking about masking right from the beginning. Now the importance now is that everyone's talking about double masking and masking at home also. Also the point here is that when you are wearing a cloth mask, a 3-ply also, or even a double mask, you are actually protecting the person in front of you. Oh. So it is extremely important to understand that whoever you are interacting with is wearing that mask over their nose and over their mouth. So you wearing that mask and sitting and the person outside that's talking to you like that is really not helping. So you can protect, it's a social etiquette. The person who is in front of you or the person you are interacting with, it's very important to see that they are wearing their mask properly, because you are going to get your infections from them. So that's the most important thing you need to understand, that it's not only social distancing, but it's the person in front of you who's wearing the mask properly. Only the N95, which we as medical professionals wear at work, we wear that from morning to evening. It's a very difficult mask to wear. It gives you bad headaches, congestion, and itching in your nose the whole day. But the N95 is probably a mask which protects us also. But normally, if you're going to work, you have clients, or you're going to the grocery store, it's very important to understand that everyone you interact with or are at 3 to 6 feet away distance with is wearing their mask properly.
And I'm talking about masks. There are like different type of masks in the market. Some people prefer the cloth masks. Then there are the blue, what are they called? The blue. Yes, and the surgical mask and the N95. So, ma'am, is there any difference between the reason? Okay, like if you are going out, you have to wear this mask, and some people say that the cloth masks are not actually that useful. So, like, is there any reason behind it?
Right. So the 3-ply mask actually has an ionizing layer which prevents the virus from entering through the mask. Okay. The N95, sorry. Right. And so that is the safest mask to wear anywhere you're going out. Usse zyada protection aapko kisi bhi cheez mein nahi milegi. Right. That's one mask. The other mask that we're talking about is the surgical mask, the 3-ply mask, the blue or green mask that you were talking about. That also now has a new protocol when we're wearing it. You have to tie a knot on the side and only then wear it, right? Because that prevents the entering of aerosols from the side, because a lot of times there's a gap on the side.
Right. Mm-hmm.
Or third is that you wear, for it to your cloth mask to fit better, you have to double mask it. There is no point in wearing the cloth mask alone. The protocols are also changing as time passes, because as we can see, this virus, the second wave, the virus is way more infectious. And it stays it's more airborne, right? So as of right now, this is the protocol that's being followed as per the masks.
And most importantly, no one should wear a valve mask. The valve mask should not be worn. So if you see anyone, because like I said, the person in front of you, when they're wearing a mask properly, they are the ones who are protecting you. If he's wearing a valve mask, all the air is coming out. It's not protecting you at all. So if you see anyone in front of you wearing a valve mask, it is within your legal rights to point it out that, please change your mask and wear a mask if you want to be in front of you. because it is not protecting you at all.
The wild mask protects the wearer, but it does not protect the person across.
Because that's also with only a N95, not with a cloth wild mask or something.
So that's why in hospitals and a lot of these government buildings, they don't let you enter if you're wearing the wild mask.
Oh, ma'am, this is brand new information. I mean, we could not have gotten this either on WhatsApp or Instagram. So, like, yes, ma'am. And ma'am, so yes, on the same lines, ma'am, we have a question from Mr. Rajita saying that as we're expecting a third wave in the coming weeks, is a mask enough to protect against the deadly virus, no matter how worse the situation gets?
Mask, hand sanitization, social distance, vaccination. We have nothing else. So let's just work on all these four and make them perfect.
And ma'am, one more question is, if both parents are COVID positive in a family, how can they look after their COVID negative child? So this again brings us back to the child aspect of the equation.
Which I'll be taking care of. So amongst children, it depends what the age of the child is. If the child is feeding, then you can obviously assume that the child is also going to be positive. And it's not possible for you to make the child stay separately. But if the child is a little older and can stay with, say, the grandparents for a little while, then obviously that is preferred. Difficult, but
yes, sir.
Whatever you can.
And ma'am, so if a person gets infected, then his SpO2 levels, they drop down. So what is the which is the SpO2 level at which a person should think about getting them admitted in the hospitals? Because sometimes people try to treat themselves at home only. They think that if they'll take the medicines and like follow some routine exercises, then that will help them. But what is the level at which they should think about getting admitted to the hospitals?
So, firstly, the most important aspect is whether you're checking your SpO2 correctly. Your pulse oximeter needs to be connected for about 30 to 45 seconds. You need to be taking deep breaths. Because a lot of times initially the reading will be low and people will panic that my reading is coming low. But just by waiting 30 seconds, you will see that it rises up to normal level. Now, if your SpO2 is dropping below 94 or 92, then you should be on oxygen. This is SpO2 on room air. If it's below that, you should be on oxygen support. After you're on oxygen support, you should obviously, like if your SpO2 is dipping again and again, then that would be an indication to in a hospital. But all of this should be under the guidance of physician, because your individual case is very different. If you have, say, other risk factors, if you're elderly, if you're diabetic, he might want you to be admitted at an earlier stage. So being in constant communication with your physician about the disease, about what your SpO2 levels is the most essential takeaway from this.
And ma'am, apart from this SpO2 thing, there is also the option of taking CT scans. So one of the questions is, what should I look for in my CT scan? Or is taking the CT scan even more critical? Because I think some days ago, one of our ministers had said that you should not go for the CT scans because it causes cancer. So like, what was that about?
So basically, it's very simple. So in a CT scan, a doctor would look for two things. One is for a reason to diagnose the patient. You don't know if this patient has COVID or not, and figure out whether he does. And the other is to figure out the severity of the disease. In case of whether you're figuring out whether the patient has COVID, there is a CORADS criteria, which is from 1 to 6, 1 being not likely, 5 being most likely, and 6 being confirmed with RT-PCR. And on the other hand is a CT score, which tells you the assessment of your lungs. Now, overall, the fact is that CT scans are a very good procedure, but at the same time, a very labor-intensive procedure. They require a lot of time, a lot of resources. So the government does say that you should always get it prescribed by a doctor, because a lot of people had been getting CT scans done for themselves when it wasn't essential. So going to a doctor, seeing a doctor, said that he says that you need a CT scan, or whether you need an X-ray, which is an easier procedure, which gives you a lot less exposure to radiation. Which one is required for you is essential. CT scan is not essential really, but in very severe cases, it is a very good tool to assess the amount of COVID they have.
So like talking to your physician is the most essential part before taking any steps further.
Absolutely.
You should always.
Yes, sir.
You should be in contact with a physician or a chest specialist almost from the word go. Most of the times, you actually can preempt, you can actually predict a particular direction the disease is going into. and you may be able to get pointers a day or two before that actually happens. Pointer that advance notice is good enough to put you on the right treatment, or you hunting for some oxygen, or for you to try and get into a hospital. Most people don't do that, and that's where all the the emergencies suddenly arise. Suddenly the oxygen dips, the person needs to run around. If you have these indicators with you already, and that shows that you are unfortunately headed the wrong way, then you actually this actually gives you advance notice, and you can actually plan accordingly.
See, we've already started understanding the progression of the disease. That the first 3, 4, 5 days you're going to have fever, or you're going to have symptoms of body ache and all. Now, some people will themselves go and get their CT scan done at that time. It's useless. So that's why it's very important to understand from your doctor when you need to start what. If they want to start antibiotics, if they want to start antivirals, if they want to give you zinc, vitamin C, whatever. I think it's really important to get it done from, supervised by your doctor. When to get your blood work done, whether you require the test on the 6th day or something. Don't get all the blood work. People are talking about, everyone here today is talking about CRP and ferritin and LDH. This WhatsApp university has been really bad on that. And nowadays it's very difficult to even get tests done because of that. People get a positive report, then they keep on repeating their RT-PCRs, they keep on getting negative, but they're symptomatic, they keep on getting those tests repeated, getting their blood test done from the 2nd day. So we are wasting resources, and now the problem is that you are getting reports in 4 days. So it's really no point. We all need to understand that the tests need to be done at the right time, at particular indications, And just because there's so much of information floating on WhatsApp, it doesn't make you a doctor. Do be under a supervision of a doctor. That's the first thing you need to do. And follow instructions. Decide the doctor you need to follow, and don't discuss reports with your friends. It's really not going to help. It's just going to increase the confusion.
And the panic. So one of the other questions that we've received is, how many times should I check my SpO2 levels in a day? So on the same lines that people think of themselves as the doctor. So what is the number that you would suggest? Once a day, twice a day? Because I've seen people check it 6 times a day, and they're like, ab ek kam ho gaya, do kam ho gaya, ek badh gaya.
See, checking is fine. Every 4-5 hours is okay. But then you don't have to jump at every point up and down. So basic thing is, it has to be a sustained drop over a period of time, and not one point, but a longer drop is what you're looking at, and a bigger one too. So these two things have to be on. So I think 4 to 5 hourly is a decent time frame where you should be checking. Don't go berserk.
Yes.
Any further. And then again, one point here and there is not such a thing. You kind of just keep track. If there's a sudden trend, it's going down, then maybe you should.
And do it correctly, like Dr. Arman said. It's very, very important. Because the minute you put it and suddenly it's like 82 or 83, don't kind of just if you're feeling comfortable, it's probably going to be okay. Just, try putting it again, or wait a little while, or change the finger and put it again and wait for about 30 seconds. It will come up to what is your actual level.
And I'm talking about going berserk and everything. So people nowadays, in order to build their immunity, they are shifting to yoga. They're trying to make a schedule for this, a sleeping schedule basically, so that they're healthier in the morning and everything. So how far does it help a person in not getting COVID? And does it help?
The toll of COVID is not just the amount of people getting the infection itself. Even the people sitting in lockdown and having mental illnesses because of that is also toll of COVID. The other diseases that are basically usually would be avoidable, or people could be easily saved from those, but they can't get admission. That is also toll of COVID. Being able to maintain your general everyday health is also very essential during this period, and it's more important than usually it is. If you're not feeling mentally fine, you will not be able to feel fine. And so hence, I feel that is the place where this holds much more importance. Yoga, breathing exercises will help you during your COVID period in your recovery, in a quicker recovery. They will not help you in avoiding COVID itself. But if you do have it, the breathing exercise will make your lung muscles very strong, and hence will help in recovery.
Also, you're locked down in a room. So definitely, while if you're having COVID and you're doing a little bit of yoga and a little bit of breathing exercises, especially from yoga, you're opening up all your lung spaces. So it will increase the oxygenation to your body, make you feel calmer and more relaxed. So the anxiety bit also works and it does help you with your lungs. So surprisingly or not surprisingly, yoga has been seen to be beneficial with COVID patients and with the rest of the family also by giving them mental relaxation.
Mental peace and a sense of well-being. Like, so
Absolutely.
the only advantage, if I may say, of this condition has been that mental health has come to the forefront now. Like you have a lot more friends who tell you, ki, okay, today I'm meditating instead of saying today I'm watching a movie. So that helps in the longer run as well, and that helps in keeping themselves also calm and not spreading panic anywhere. So that is something which we should look forward to even after the COVID situation ends. And I'm moving to the next question. So it is key, since once a person is infected with COVID, and since COVID has become even more infectious in the second wave, how can one dispose of their garbage? Like an infected family, how do they dispose of the things? Like, should they sanitize even those things and then dispose it? Then, like, what should the procedure be like?
Things have been made very simple by the government. Now all RWAs and government organizations are just a phone call away. They will actually place a special bin for you, and you can leave your garbage in that bin which is extracted by DCP. You should never try and dispose your regular garbage with the garbage of other people in the building who are not affected, because this does contain infective material and can actually spread the disease further. So it's simple as that. Previously, we were in a bit of a bind. We were supposed to treat it with hypochlorite spray, karke, and then it had to be packaged separately. But luckily now, most governments or most local municipal authorities have arranged these pickups, specific pickups for.
So there is a helpline available. So you can just call up and then they also call you up during the day that, the van is outside. So is your garbage there? Do you have any more garbage to give? And then you can just give it.
And the next question, it seems like a slightly political question. Has COVID really originated from China? I think we can skip this question. Yes. Yeah. So, so ma'am, so this question is from Mr. Anirudh Goswami. After recovering from COVID, how long should one wait before getting vaccinated? Like, is there a specific time limit? Because everywhere, some say it is 3 weeks, some say it is 4 weeks.
So the point is that the disease is also giving antibodies to, and so are the vaccinations. So what it is believed that if you say got COVID, say even after the first dose of the vaccination or before you got vaccinated, wait at least a month. And probably it's not a bad idea to check your antibodies at that time. Because as healthcare workers, we were taking the vaccine 3 months after we had got COVID. If we had got it earlier, say in the last wave. So after month, check your neutralizing antibodies and wait another month. And if they are dropping down, then you get your vaccination done.
Your IgG level.
So, supposing somebody would want to donate plasma, we say wait for 15 days post becoming normal.
Oh.
So antibodies coming up around 15 days after. So the window is not so small that 15 days later it'll come up and drop very drastically. Wait for about 3 to 4 weeks. 4 weeks again, you be very sure you can get your antibody levels done. Antibodies, and if the levels are high, then you wait a while because the chances of complication with the vaccine also increase if the antibody levels are high. So it's not just that it does not only doesn't give you the appropriate or the correct protection, but it also increases the chances for complication.
So in simple terms, I would say that a month after you recover from COVID or 15 to 20 days, get your antibodies checked. If they are a high number, be a plasma donor. And if they are getting down, then you should sign up for your vaccine.
And ma'am, another similar question on the same lines is from Prachi Kumari. It is, what if the second dose got delayed by 2 to 6 weeks due to unavailability? And will there be any side effects? And are there any side effects of the vaccine? So these are two questions.
So one thing is that we started off by saying that booster dose should be given at 4 weeks. Then the UK government stepped in and said 6 to 8 weeks. And now some of them are saying 12 weeks. Okay. So in a way, what's apparent is 12 weeks stuck, it still should be able to work for you. And then you can actually go ahead for other thing. But then, I mean, I would rather not wait for 12 weeks specifically. Anytime after 6 to 8 weeks is a good time. But then just because it's got delayed from 6 to 8 weeks or 8 to 10 weeks, don't have to assume the first. Go get shot.
And as for the side effects part, I think you have to weigh the pros and cons. COVID is a new disease that we're seeing in spread so rampantly amongst all of us. So it's deciding between getting COVID and seeing what its side effects will be after a few years, and getting a vaccine which has been studied in the lab and it has a very small component of the virus incorporated inside. So you have to weigh your pros and cons, and obviously we definitely endorse the vaccines. That's why we are getting it done ourselves.
See, vaccinations are there against viral and bacterial diseases. I think the day you're born, you get your BCG vaccine or the next day. So then you get your DPTs and you get the polio vaccine and all. So it's not something new, vaccination has been prevention of diseases right from the beginning. So there is no reason why we should be skeptical about each and every vaccine. If it is there, available for a disease which can and is known to be deadly, and we have a protection against this, I don't think that little fever or soreness on that area should be something which keeps you away from the vaccine. So the vaccine is definitely very important, and the side effects extremely minor. They should not dissuade you from getting the vaccination.
And the ones which we were very high profile side effects which we talked about in the past, that's extremely, extremely rare. The chances of a person succumbing to COVID is far higher, many, 100 times higher than actually getting that complication. So I don't think I think it's a no-brainer. You should actually go take a shot.
Also, there are a lot of rumors that people are saying that, they've gone and got the vaccination done and then they've had COVID the next day and all. So a lot of people are talking about that will I get COVID if I get the vaccination? You can't get COVID from the vaccination. You must be clear on that. The provider who is giving you the vaccination is as scared of getting COVID as you are. So they are also taking all the necessary precautions which are there. The important thing to understand is that if you have been exposed to someone in the last 2-3 days who was COVID positive, or if there are people who suddenly develop a little bit of fever or body ache or symptoms of COVID, and then they get so scared and they think that, okay, let me go and get the vaccine done. It is not going to help once you have COVID. So please, if you have any symptoms, don't have that much sense and don't go and get your vaccination done and infect all the people around. So that's how a person can get COVID if there is someone else there who already has COVID, right? COVID can't kind of come out of the blue. Someone has to have COVID to give it to you. So if you have symptoms, the vaccine is not going to help you now anyway. So you might as well just isolate at home. And when you are going for the vaccination, try to go to a center which is not very crowded, which is a hospital where there are not COVID patients, so that the exposure to others are much less. And of course, wear your double masking or an N95 when you go to get the vaccination done. But yes, I think there is nothing more important than the vaccination, except of course the mask. But yeah, the vaccination is extremely important at this point in time.
And ma'am, another trend is that people who already are suffering from something else, like for example, patients of diabetes. So in their families, they are told, okay, this is not the right time to take the vaccine. So is this the correct mindset to have?
No, absolutely incorrect mindset to have. If you do have diabetes, then your complications associated with COVID will be more severe. And so hence it is more essential for you as somebody with comorbidities to go get the vaccine first. Hence, the government opened up for these people first because it is more essential for them instead of less.
And ma'am, the next question is a bit technical. So it is, what are the mandatory blood tests in COVID and when should the HRCT test be taken up?
See.
So this is exactly what I was saying, that you need to be supervision of a doctor. There is no mandatory thing in this. So, but usually in the first couple of days, just your RT-PCR is done to kind of confirm the diagnosis. And possibly after 5th or 6th day, when we expect that lungs and the tissues will be happening because of the disaster that virus is causing in the body, that's when your physician may, let me put in the word may, because again, it is definitely the to tell you what test you need. So probably a CBC, a CRP, a D-dimer is done. If it is someone who the doctor suspects more, they might get a serum ferritin, LDH, or IL-6 also done. And if they feel that the oxygen is dropping or your CRP is increasing, then they might be asking for your HRCT. But please don't get these tests over and over again. We are emphasizing here that we are doctors, but we are not treating you as your doctor alone. So it has to be, every person is individual. We are not Maruti cars. We are human. Every person is different. Your doctor knows your history, is analyzing your case, and he is the right person to tell you if and when you require these investigations and how often they need to be repeated. So if your doctor tells you that today get the test done, you discuss the reports, and the doctor tells you, okay, then now 3 days later, get these tests done again. Please book that day only for the test that day so that you can get your reports in time and discuss again with your doctor.
I think this part of this webinar is the most essential one. So I hope that all the listeners have taken note of all these points. So, ma'am, our next question is from Ashna Singh, and she has 2 questions. So the first is, can I donate plasma if I have hypothyroid and take medications for it regularly? And the second is, when can I resume exercise? Can I exercise while I'm infected or if I feel mild symptoms? So there are 2 questions. Which one would you like to answer first?
So I'll take one of them, and I think Dr. Mrinalini can take the other. So you asked her if she's hypothyroid or hyperthyroid, can she donate plasma? Yes, all women can donate plasma unless they've already had children. So if once you've had children, because there are the HLA and all because of the pregnancy, then you cannot donate plasma. So, but otherwise, hypothyroidism or hyperthyroidism, like donating blood, is not going to affect your donating the plasma either. Getting back to when can she resume exercise? You want to take that?
And that totally depends on how you're feeling. Actually, when the virus enters our body, it's almost like a war is being fought between our immune system and the virus itself, which is why you get all the symptoms. The symptoms is the body acting up against the virus. So only when you are comfortable, you actually have to give some amount of, rest to your body, and maybe you should take up this time to concentrate on your mental health more than anything else. Slight, very like pranayams. We've done a video of that also on our channel. So you can do some pranayams just to strengthen your lungs and keep your anxieties at bay. And after that, it to person. Obviously, now if someone has very form of, they will take a long time to come back to their normalcy. So you have to give your body that space and time to recover, and only then you should go ahead with your regular routine.
And wait for your body to heal and push yourself. Eat well and do, a little bit of stretches and all, but take whatever time your body will need to get back to normal before you start pushing yourself.
Well, they should begin slowly with some mild exercises, and if they feel comfortable doing it, then they should do the high strainers like weightlifting and stuff like that. Okay, no weightlifting. Okay.
Don't push that. Don't push your body. See, there's a time when you feel that yes, you must push yourself to get better and feel normal as soon as possible. This is a disease where you need to give it time, probably just a walk or relaxation or something, and easy exercises and probably high strength exercises. Just keep it on the back burner for a little while.
And ma'am, one more question is the repeat of the RT-PCR test necessary after 14 days? So is it necessary or is it not?
No.
So basically, to be assumed as you are not infective anymore, you need to wait for 14 days, and 3 days of those, like the last 3 days, for 72 hours, you need to be completely asymptomatic without any NSAID, any painkiller you've taken.
Yeah.
And now talking about people who actually get cured from COVID, so like by which day can one come out of isolation and be sure that he's not contagious to the other members of the family?
So the virus stops spreading in your body after about spreading outside your body from 7 or 8 days. So the guidelines currently, I'll talk about the current guidelines because they are changing all the time. The home isolation guideline says that if you have been isolated in your room for 10 days and you have not had fever for the last 3 days or any other symptoms, then you can move out of your room in the house wearing a mask at all times. And from day 14, then you can move out of the house, but again, wearing a mask.
And ma'am, this next question is, I think, like it is directed straight for the medical professionals. And the best part is that you all are from different degrees of medicine. So this question is, so do you think that India still needs a permanent lockdown for the doctors to start working on the vaccines as well as for treating the patients who are already infected? So what is your say on that?
See, there are two aspects to this. One is the medical aspect, the other is the practical aspect. Unfortunately, that balance is very, very, one has to strike a balance there. What happened during the first lockdown was led to some major economic fallout. So the government obviously is a little worried of doing that. I think we just have to play it by the ear. We just have to see that we have adequate infrastructure working, and once the adequate infrastructure is there, and so that we don't entail much economic costs, the government will start opening up. But then at the end of the day, whether or not the disease is controlled is entirely in the hands of the people. It's even when the lockdown was not there were people who were going around brazenly without a mask, fighting left, right, and center with anybody who's asking them to put the mask on. If they had been putting a mask on, we might not have come into this situation at all. So the government can only help with a lockdown or creating the infrastructure, but at the end of the day, it is a common man who has to take it to heart and understand that basically the onus we may be placing at the government's doorstep, but then we are equally to blame by not wearing masks and sanitizing.
It's absolutely ridiculous how people fight back if you ask them to put a mask on. So you should also know your rights, stand your ground. And I know I'm going to sound, this is a very negative light to put on myself, but I have actually even called the cops on someone when they refused to wear a mask. Because I was walking alone at 9 o'clock at night because I hoped that there would be no one in the park and I wouldn't have to, come across people who are not wearing a mask. And that man refused to wear a mask. So मैंने तो सामने से there's a ठेका यहाँ पर ही, so I just called the cops and they were more than happy to help. So know your rights and stand your ground.
At the same time, remember that, lockdown or no lockdown, your health has to be your priority. And even if the lockdown does open up, we all know that it has happened in India, happened with the Diwali parties, and it happened with the holy functions and other religious functions from other religions. So it's like that when there's a congregation, there's going to be a problem. So it's a party when you are removing your mask and you're in close contact with the other person, that this is going to happen. So responsible social behavior is extremely important, even when the lockdown does open up. And even then, I think you should still remember to stay at home, go out only if it's really required. And whenever you're going out to, promote wearing a mask and doing this. So normalization, lockdown or no lockdown, I don't think normalization is going to happen in a hurry.
And ma'am, as professionals in the field, is there one advice that you would maybe like to give the government? Okay, this is something which you should apply right now if you want it to be controlled. Because this question is a little bit political, and I think the questions are shifting more to the political angle right now. But we have seen in the past weeks and in the past months that people are complaining that the central government is not actually focusing on the disease, but on their electoral votes. So right now, is there something specific that you would like to suggest?
The government has made an advisory board of a lot of doctors, senior professionals in their fields in Delhi to advise them. I think we should leave the advising to them. And frankly, again, I think it's again like the WhatsApp university that we were talking about, that everyone wants to treat everyone and everyone wants to make changes at the national level. And we are not ready to make them on a personal level. If we do our bit and we have to leave the policies to the people who are making it. So while you're asking a political question, let me be very diplomatic but very clear that you follow it for yourself. And I mean, whatever the government decides, just follow the rules which are set in whenever they do come
I
in.
think the change has to start from the grassroots level rather than up above. We actually gather the RWA, the resident association, and badger them that make sure that all the residents who move out of the houses actually follow the social distancing and mask now. I think we'll do much better there rather than looking all the way up. Because there we're helpless. What the government does, we're helpless with. But what we can do at a local level is much more manageable. And I'm sure most residents are as scared as you are. The best you manage at a local level than all the way up.
Like I think it was Mahatma Gandhi who said, "Be the change that you want to see in the world." So
Absolutely.
if we are able to take care of ourselves safely, then the whole community, the whole society, and as we grow, as that we expand, then the whole country would be safer. So, ma'am, thank you for that answer. And ma'am, last year there was an article I read in BBC. It was after the surge in the COVID pandemic, they expect that for 6 or 7 years this disease will stay. Like even if the vaccination is there, we'll need even more and more research, and people will need to be made more and more aware of the disease. So like, do you, as medical professionals, do you have any time frame in mind that when this might end? This is quite a big question actually, now that I think about it, when this might end. But like, what are your views on it?
So, truly speaking, once a disease does enter, there is a new disease. It stays for as long as it can. Like it will be there forever, for times immemorial. There will be spurts of COVID. COVID will become like a phenomenon like swine flu is now. Well, every 1 or 2 years, you have like a swine flu epidemic, which is local to an area, endemic. So that's what we expect to occur with COVID. Herd immunity is a thing, but viruses overall have this uncanny ability of being able to mutate very quickly, faster than we can create vaccines and do research. However, vaccines do provide partial immunity. But COVID, the response to COVID will be a constant, need of the hour for like a couple of years from now. I would say most experts say that the biggest wave that we are undergoing right now, the second wave, its peak is to come in this third week of May. So the biggest peak of this entire disease is going to go away in about a couple months, we can say. However, this disease will not completely cease to exist for multiple years.
I think we have to get used to more sensible traveling, more sensible moving about. I remember 10 years back, I had gone to Korea, and everyone in the airport, Koreans used to have this mask on their face. And if you go to China or Hong Kong, there's so many travelers who used to have masks on their face even 10 years back or 8 years back. I think we have to get used to that face now in India also when we move out of the house. I think it's here to stay, unfortunately.
So one of the theories is that it may become something like the flu. So you may need to actually take boosters practically every year because the virus mutates. And there are 2-3 things which may happen. So the virus may mutate into a much milder version. So it does cause something like a cold or a mild body ache. Or the other thing is, if it does continue to be this virulent, then in such a case, I think the vaccination program and this we'll have to keep up, and then maybe trying to drive the disease.
32 years back also, it was part of our textbooks. Coronavirus was there when I was doing my MBBS. It was a little column in my microbiology textbook, but coronavirus did exist. So it's not that it didn't exist. It's become a pandemic now. It was there earlier. It was a rare possibility of a disease. Now it's like he very clearly said, like swine flu or bird flu, which keeps on coming in. You keep on taking precautions at that particular time when it's spreading in a particular area. But yes, we are hoping it doesn't continue to stay as a pandemic or involving the whole world.
And ma'am, one of the other trends is that in the Indian vaccines, the medical professionals, even after getting both their doses, they are still getting the disease as, yeah. So, but the Pfizer vaccine in the US, this trend is not that common. So, like, what could be the reason behind that, right? Is it the quality or is it the strength of the virus?
It's the Indian virus. There is a double mutation virus that has come into the entire picture.
As well as the Kent virus.
This virus itself has a very different immunity structure to it. So So you will see people who have gotten vaccinated before, or people who have already been infected by corona also getting infected by it again. And that is the reason. We have a very different sort of mutated virus in India right now.
So putting it simply, I wouldn't say that the American vaccine is smarter. I would just say the Indian virus is smarter.
There's an advisory from the American government for people traveling from the US to India that this virus may actually go around the vaccine. Okay, so we're not sure. The Indian virus and the American vaccine, Pfizer, have not met yet. So when they do meet, we'll know. So.
And the Pfizer vaccine was, I think, developed in Germany or something. So, like, the research in the Indian vaccine has been on the basis of India only. So, what I personally feel is that, like, for the Indian vaccine also to develop more, we still need more research in this field. And like you all rightly said, it is a new disease.
Yeah.
We'll have to study about it. So, we have still got time. One more question is, after how many days weakness and easy fatigue will go after testing COVID negative?
Again, it's a very similar question of how much COVID has infected your body itself. In most cases, we would expect it, however, to go within a fortnight or so. In more severe cases, it can take up to a couple months for you to completely recover. And one of the last symptoms to go away would be cough. But like the fatigability and everything, you will see a pretty rapid improvement in the initial few weeks. And it also is to do with the person's own healing mechanisms and everything as well.
This is where your yoga comes into play. Like it's a prophylactic measure to make sure that you are in good shape, so that in case you contract the disease, you recuperate much better.
Also, probably how much the disease has affected your lungs and the rest of your body. So obviously, if you've been into the ICU, you will take 2 to 3 months to get back to normal. While if you were in home isolation and the disease was kind to you and your body took it well, you should be back to normal. However, yes, it does affect. There is a little bit of fatigue which does continue. So even if you try to feel normal, it does take about, I guess, a month or something. But do work on yourself. And similarly, if you have been in the hospitalized, chest physiotherapy, exercises, breathing exercises, your recovery period also becomes very important. Good, healthy eating, high proteins to take care of the breakdown of the tissues that you had. Mind relaxing, all of that. It's a complete healing total package. It needs to come from everywhere. And you have to accept the way your body, I think, takes its time. So depending on the disease and how the severity is going to be the recovery and how well you take it and how hard you work towards your recovery.
Be kind to yourself.
Don't yeah.
Too hard. That's all.
And one person asked, is taking vitamin C supplements necessary to be protected from COVID? I think it is because people say that taking vitamin C supplements and things like that actually help from COVID. So is it a myth or is it a reality?
It doesn't prevent you from getting COVID. It just makes your immune system more robust.
In general.
Vitamin C is considered good for flus, colds, coughs,
viral infections.
It's a good thing to keep your immunity up. But no, if you're not wearing your mask and you're eating vitamin C pills, it's not going to help you.
It's not a replacement for vaccination. You can't give vitamin C and say, okay, fine, forget the vaccination. You protect it now. That doesn't happen.
And
so we've seen a lot of people having kadas and Giloi and all that, but yeah, probably it works on your immunity, but it can't. Only thing which will prevent or probably save you from the illness or disease is actually the mask, the hand hygiene, the social distancing, and the vaccination.
Yes, like you talked about the WhatsApp university, you always have messages ki haldi, then 3 grams of ginger, 1 almond. They have this whole recipe.
And I don't think any of the doctors have had time to have that kali mirchi and all that. But we've been going to work also every day, and there are doctors who are working in COVID wards also. So actually, it's your N95 or your mask and your hand hygiene which protects you. Again, the same thing, it's not necessary to be investing in expensive hand sanitizers and all. You use them when there's no water available, but otherwise, even washing your hands with soap and water all the time, in contact or otherwise, that itself is good enough. So it's not that you have to invest in something big, But you have to take care all the time, for sure.
And ma'am, the next question seems like a pretty direct one. Why do we have to wash hands for 20 seconds?
Because that's the time it takes to destroy the virus in your body. It's there, it's on the surface. We need to clean it out. So there is a typical hand hygiene
Scrub.
technique.
Yeah.
And so it takes about 20 to 40 seconds to remove the virus from your hands.
And,
It's about washing. It's not the antibacterial soap and all that. Even a normal soap.
and even if COVID is not there, it should be a general practice because 20 seconds is not that big a amount that time waste ho jayega, kuch ho jayega. So yeah.
Great.
And so going towards one of the last questions, it is from Mr. Indrajit Jana, who says, how can we keep ourselves safe with and without the vaccination? So I think this whole webinar has been for him specifically. So without the vaccination, he wouldn't be safe. And with the vaccination, you have already answered that question. So Mr. Jana, I hope you have received your answer. And yes, I think these are most of the questions. One more question is, after how long can I get vaccinated if I've already recovered from COVID? You have already answered that question. And yes, ma'am, so one of the recent trends is that people are using false RT-PCR reports to this depends from person to person, that people don't want to tell people that they're COVID positive because they think that they will be left out, or like the domestic workers that are coming in their house, that will also be stopped. So like, how wrong is this practice, and how is this also one of the factors which has led to the rise in COVID in the country?
Yeah, there have been instances where people have had small group weddings with 40 or 50 people when they were allowed, and families had actually asked for the RT-PCR report. And, people who are having destination weddings and can afford air tickets and all also have given false RT-PCR. It's really shameful is what I would say, and complete lack of sensitivity. And I think what goes round comes round. It's probably the most unethical thing that you can do. And that's why I say the first symptom that you have, it is your responsibility. I was probably the first person in my house who got infected, and I was in the hospital and I had this severe backache suddenly. The first thing I did was stand up from my seat, and I can tell you that my associate was sitting with me, touch wood. She didn't get affected. I was having a patient in front of me in the screen. I just got up, called up my hospital MS, and I'm going to a room to get isolated currently. Please send someone to take my RT-PCR test. I asked for a tablet of Dolo. And from the hospital itself, I told my husband, I'm coming back in 15 minutes. Get out of my room. Take out whatever you need for the next 10 days. And, I'm isolating. So that is the sort of thing that you must have in your mind. Please, I think the disease creates a problem only because you remain in denial. If there is any change, to be on the safer side, please isolate immediately. And we've not had help in our house even till now, because there is a particular time that you need to be there. It's not that something you have to be ashamed of. If you have a disease, it's not like, I don't know, actually there's no disease that if you have it, you need to hide it from anyone, frankly speaking. Because I think it is really, really important that all this I don't know, this I think happens only here. It's very unfortunate. About fake reports and not telling people and spreading the disease. It's really probably the worst thing anyone can do.
I'm like they say that there are always two types of people in the world. So people who actually think of, like you, who actually want to isolate voluntarily, and others who like hide their reports.
I don't think in the world, I think unfortunately there are more here. People have this thing in India about trying to, this doesn't work for me. And it's very selfish, self-centered, inhuman, and for lack of, I don't know what, but I really would avoid such an attitude. It's really wrong. And I think these are the people who should be actually pointed out. And like people who've been, black marketing stuff and all. At this point of time, we're thankful that there are more good stories of people helping out with Gurdwaras pitching in for oxygen, and strangers coming up and helping out people wherever they can. But unfortunately, this happens frankly only here. I really don't think this is the attitude people anywhere else in the world have. This cutting of lines and doing things wrongly. Very sad.
Ma'am, so the last question for the session is from Mr. Nishit. He says that taking zinc tablet 50 mg regularly, is it safe? I've seen everyone is taking 50 mg zinc tablet every day, although RDA is 11 mg.
So that's zinc acetate, which comes at 50 mg. So that is the recommended dose.
Zinc acetate also has the mass for acetate, right? That's not just the zinc's alone weight in that entire tablet. Then you have like other things which are mixed as well, just to make it dilutable and edible. Hence, the 50 milligram tablet would give you about an equivalent, which would, after getting absorbed by your body, come around to 11 milligrams, and hence it's safe.
Also, probably the 11 grams would be milligram would be the RDA of counting it in your diet and all. And for a prevention, if you need a little higher dose, which is recommended during the pandemic, you don't need to have it for years. Zinc actually helps the body in healing also. So probably when a patient has a surgery and or otherwise normally also when we were having recuperating patients, we do give a higher dose. It's like calcium, your requirement may be 400 milligrams, but when you're pregnant or when you need more calcium or your bones are weaker, we do give you a higher dose. That's called a therapeutic dose. It's not a prophylactic dose. Or the RDA, it's usually a little more than that also. So that's all right.
So I hope that answers Mr. Nishit's question. So ma'am, with that, we come to the end of this webinar. And thank you so much for agreeing for this webinar. This was the need of the hour. And ma'am, before going, do you have any parting words for all our attendees and who look up to you as the frontline workers right now who are actually saving the nation? So is there anything that you would like to say to all the people?
What we started with, please wear a mask, social distancing, hand hygiene, and vaccination. It's important for you to keep safe. Help us be safe so that we can keep you safe.
And no WhatsApp MD, please.
Okay, then. So thank you to all the attendees for attending our session. And apart from that, our organization Lex Macula has partnered up with the Kitchen of Senior Citizens. So the details for the bank account on which you can donate the amount is in the description in the video below. Apart from that, we will also add the link for the Instagram page of all of our honorable guests who are present in front of us. You can go and follow their page, check out their highlights, and if you find anything useful and if you think you can help anyone out, please do it. We need all the help that we can right now. This is the time for love and not hate. So please save as many people as you can. And thank you so much for joining our session. And do check our description. Thank you.
Thank you.
Thank you.
Thank you so much, Manson.